First, I want to thank Lauren and Lucy and really all of the speakers. It's really a pleasure to be here. Carolyn Witzman once titled an article that was about feminist urban planning, The Loneliness of the Long Distance Runner. So it's really nice to be here with other folks so invested and interested in feminist approaches to housing, to homes, to care, and to cities. So thanks everyone for your efforts. So housing and other forms of precarity have certainly been made more visible during the pandemic, but we know they're rooted in decades of not just neoliberal, but patriarchal, racist, and colonial policies that have not only devalued particular bodies and communities and activities, but also heightened housing as an asset for exchange rather than something that's part of a broader infrastructure of care. And today I'm going to talk about, and I think this builds nicely on things that have already been said, how burdens of housing precarity are not evenly shared. And my work has been focused on Canada and the United States, but we're also starting to look at kind of models around the world that counter that. So I'm going to start by talking about kind of 5 ways that gendered intersectional relations, what I call everyday disparities, shape vulnerabilities and experiences around homes and housing. And how these have been kind of deeply amplified by the pandemic. And I would argue that these disparities really remain underexplored, as do feminist and intersectional approaches to housing and urban planning, as Yaz and other folks have already discussed. So the first of 5 everyday disparities really is about the caring overload. And this has been talked about already today, but we know that women still conduct the majority of caring labors in both households and communities, and that these have been exacerbated by the pandemic as schools, caregiving facilities, et cetera, have closed. And most of these burdens have fallen upon women. And I also want to say, and I know all of us as feminists recognize this, but caregiving is about so much more than parenthood, right? So women are more likely to care for sick and elderly relatives. In communities where I work, which have really been targeted by the racist state, incarceration and other issues have really destabilized communities, and women have stepped up caring for other people's children and caring for communities. And informally, as staff in nonprofit organizations, women are often on the front lines. So we know, and they're also working in careers that are focused on caregiving, so as nurses, et cetera. So we know there's been this kind of intensive burden of caring that continues to fall upon women disproportionately, women of color, and that it's been amplified during the pandemic. We also know that this deeply relates to housing and homes, and that caring labors can't be done without supportive homes and supportive housing structures. And many of you have already pointed this out. The second everyday disparity really is about gender-based violence. So gendered, intersectional, structural, and intimate partner violence is pervasive. And again, I want to point out that this is not just about what's happening in the household in terms of abusive partners, but it's also about violence from intimate partners, family members, employers, and even landlords who push women into difficult choices, such as staying in an abusive relationship or job to keep housing. And I've shared this anecdote before, but I work with women who have been incarcerated. And I was recently talking to a lawyer, and one of the cases she was working on was basically a woman who had been repeatedly raped by her landlord. And she stayed because she had no other housing options. And in the end, she went to prison because she assaulted her landlord because she couldn't see another way out. So when we're talking about gender-based violence and other kinds of structural violence, including racism, we need to talk not just about what's happening in the home and what's happening with intimate partnerships, but these more kind of structural violences that make women vulnerable in so many ways. We also know that shelters, which have been kind of a weak response to people who are experiencing violence, often are insufficient. They're not culturally sensitive to women of color, to migrant, disabled, LGBTQI folks, and more. And as already been pointed out today, We know that shelter space was wildly insufficient before the pandemic, and that increases in intimate partner violence increased during the pandemic, as have other forms of violence. And we know that certain women are targeted more than other women. So we know refugee women, disabled women, women of color, etc., are more likely to experience these kinds of violence. And some of this is physical violence, some of it's the violence of discrimination, of being turned away over and over for rental housing options because you have children. So there's kind of a range when we think about gender-based violence. Okay, a third disparity, which has also been mentioned, but I want to highlight again, is really about income and wealth inequality, which is kind of persistent around the world. And again, this is gendered when we think about the wage gaps as well as wealth gaps, and it's deeply intersectional. So women are most vulnerable to poverty in the United States and Canada, I think in most parts of the world, and in particular, Black, Indigenous, women of color, immigrants and refugees, and women with disabilities. So, just a couple of quick stats, women in the United States, 30% of lone female parents have incomes less than $25,000. Now, I mean, you can look at that around the world and say that that can be actually a fair amount, but kind of this is pretty deep poverty in the United States, especially as housing costs keep accelerating. So I think most folks here know that these disparities are really rooted in a number of gendered and intersectional forms of discrimination, exclusion, violence, etc. And this is just another chart that shows kind of what the gendered wage gap looks like in the United States, by not only gender, but also by race as well. And I'm currently working with some scholars on a project on disability and economic justice. And some estimates put the wage gap for disabled women, especially like mentally disabled women, at about 20 cents to $1. So, there are all kinds of intersectionalities that matter here in terms of wealth. And of course, when we're looking at housing and homes, because we basically have a housing market that's built on capitalism, your ability to find stable home is deeply related to your income and your wealth. And there's kind of a vicious cycle of homelessness, wealth inequality related to gender-based violence, related to some of the things that I've already talked about as well. So all of these kind of 5 disparities work together to put women, especially women of color, disabled women, trans women, et cetera, at particularly vulnerable positions. Okay, the 4th disparity that I want to talk about is about health, well-being, and disability. So I want to be wary of some discourses that are pathologizing to people with disabilities, to colonizing ideas about people being fit and good workers and well, at the same time to recognize that health, well-being, and disability have a lot of gendered and intersectional dimensions, and that they're also deeply related to caregiving. So just to make a couple of points, gendered and race disparities persist in rates of anxiety, depression, and mental disabilities in the United States and Canada is the data that I have. Caregivers report much higher levels of stress. And I think someone was talking about a study in the UK about this, much higher levels of stress than non-caregivers. And we've seen that kind of skyrocket during the pandemic. If you have dependents or you're doing a lot of caregiving, your distress is amplified. Ruby Mendenhall talks about how concepts of healing and well-being in the United States and Canada, I think in other places too, are often siloed, they're medicalized, they're ableist, and we have a lot of health institution systems that are fundamentally uncaring. So we need to think about this around the whole kind of picture of housing, health, and well-being, as Rachel was just illustrating in her talk. And of course, housing precarity and homelessness are deeply bound up with well-being and health. So people often lose their homes because of mental health issues, which may have been propagated by intimate partner or other forms of violence. And then it's hard to find housing if you have mental issues, and then homelessness or being unhoused deeply contribute to further issues around health and well-being. So there's a lot of circularity here going on. And again, this is just a chart, and I want to be careful to not pathologize, but about severe mental illness and how it's distributed in terms of gender. And so you can just see here that this shows that women have higher rates of severe mental illness than men, and there are a number of kind of issues related to that. The fifth disparity I want to talk about, which I think often gets hinted at, but doesn't really often get raised unless you're among the kind of small group of feminist urban planners or feminist housing advocates. And that's really, we have such a lack of diverse women in housing and governance and leadership. So even as women need housing assistance and services the most, related to these kind of disparities that I've talked about, they often have little to say in their design. Diverse perspectives and what we often refer to as lived experience. So people who have kind of a rich array of experiences around housing stability with these factors such as gender violence, et cetera, are often not even brought into discussions around housing policies and budget allocation. So that's not to, this is not a kind of simple argument about all women are all going to vote the same way or act the same way when it comes to issues around housing and resources, et cetera. But we do know that women are more likely to prioritize things like housing and social welfare. And we know that having lived experience, diverse lived experience, brings a completely different perspective into the policy arena. And this has to do with, not just gender, but, we know, for example, Indigenous housing often is completely been designed without input from Indigenous folks and more. So really changing the terrain so that there's much more of a diversity of voices in housing and governance and leadership is needed. So these are 5, what I would say, everyday disparities that have been in existence for a long time, but have been kind of amplified by the pandemic. And basically, and this is just a quick chart that shows that in the United States, most households who need it don't get federal rental assistance. And I would argue that part of that is we don't have policymakers that understand a number of these issues and have experience with them. So what these vulnerabilities basically translate to in many places, especially in the United States and Canada, is we have, and it's combined really with the neoliberalization of housing and financialization of housing, means that women, especially Black, Indigenous, people of color, disabled, LGBTQ women, they're more vulnerable to discrimination. They're more vulnerable to eviction. They often end up in precarious or doubled up housing, even if they're not always visible in what we think of as people who are homeless. So often, because when women are unhoused, they're couch surfing or living with someone else. We don't always see that, and they don't get talked about in the homelessness literature. And we also know that often landlords aren't willing to rent to women with children. They're not willing to rent to people who have histories of domestic violence, so that there's this kind of feedback loop where once you've been evicted or once you're in an unhoused situation, because of these multiple vulnerabilities, it's harder and harder to get housing. So, and kind of laying out this framework of these vulnerabilities, I think, my collaborators and colleagues and I both feel sort of overwhelmed, as many of us doing this work do, but also feel like there's kind of always a possibility, especially during a crisis. And when we've seen kind of a number of activists emerge really around the world to start to think about housing and homes differently. So we're kind of inspired by some different opportunities and trying to look at and think through, as Rachel and other folks have been doing, about how we might think about homes and housing in different ways from feminist perspectives. So we're currently working on a paper thinking about kind of cooperatives and the commons as, potentially a way forward in terms of thinking about housing and homes and care collectively and infrastructure. So we're kind of holding out hope for the possibilities of caring futures and caring infrastructures, especially when they're led by people with lived experience, led by women. So this is one example that we've been looking at. This is an effort called Moms for Housing in Oakland, where, and the quote is, "I became homeless while working full time, like so many other working unhoused folks. Housing is a human right, and being homeless is very violent and has many harmful effects." And that's something I've just been talking about in this framework. But what Moms for Housing did, it was a group of women who basically looked at the number of vacant houses around Oakland, and they started squatting in them and living in them together, and eventually were able to lobby to be able to take over some of these homes that were essentially vacant. And they really made the case from a kind of feminist perspective around the need for care, around humanity, et cetera. And again, this is a kind of less formal cooperative than some of the cooperatives that we're looking at, but I think it shows the way that kind of women-led, cooperative, commons-oriented housing matters, and how people with lived experience need to be at the forefront of some of these decisions. I think some of you are familiar with a co-housing project in London that's focused on senior women. And again, there's a little quote here, but I think the main point is some of these cooperatives that exist really around the world have become a space, these women-focused cooperatives, although there's other and women-led cooperatives, where caring is automatically part of the infrastructure that's there, right? And that even senior women basically are there caring for each other. And that in fact, this cooperative, because women are helping care for each other, has led to the reduction of need for outside caregiving. So just thinking about how care and caring can be part of infrastructures of home and housing in more supportive ways than they currently exist. Okay, and then just again, there's also kind of a broader movement in the United States and partly in Canada to expand housing supports, which have been contracting over time. And this movement has really been led by women of color, and a couple of bills have been proposed around housing as infrastructure and the rights of unhoused. And part of this was mobilized by a group of women of color, including Cori Bush, who herself was formerly homeless and who slept outside on the Capitol steps for 4 days when the United States was ending its eviction moratorium. So I think there's a lot to be hopeful about in terms of thinking about some of these movements and around housing as infrastructure. But I think we also have to be careful knowing that gendered and uneven infrastructures have historically been the way that housing and housing programs have unfolded, especially in the United States and Canada. And so really to pay attention to intersectional and gendered dimensions of an infrastructure strategy that think about all of these disparities and that have care at the center is something that we're arguing for and thinking about and exploring. I'm going to stop there.